Hundreds of Australia's aged care residents will die of COVID because of government failure, expert warns. Royal Commission told coronavirus is a worse disaster that is still unfolding before my eyes. The government failed to develop a response plan and some care homes are cutting staff. It's not just because of cutting staff. Some of these places are just grotty. They're just fucking full on gross. Their health practices are just fucked. An aged care expert has told the Royal Commission examining the sector that COVID-19 is the worst disaster that is still unfolding before my eyes, and warned that hundreds of residents will die prematurely because of a failure of authorities to act. Where are the fucking families of these people? Where are the families of these people that you're not standing up to these bastards and going in and seeing your elderly? Professor Joseph Ibrahim, head of the Health Law and Aging Research Unit at Monash University's Forensic Medicine Department, also told the Aged Care Royal Commission on Wednesday morning he believes Australia's rate of death in residential aged care is more than 68%, the second highest in the world behind Canada at 80%. The Royal Commission heard there were several issues regarding aged care staffing, including that staff cuts had been ramped up during the pandemic, that more than 1,000 aged care workers have so far contracted COVID-19, maybe that's payback, and that many workers were struggling to access personal protective equipment, with some limited to using 2-face masks per shift. Annie Butler, the Federal Secretary of the Australian Nursing and Midwifery Federation, told the Commission a union survey showed aged care facilities have been ramping up staff cuts throughout the COVID-19 pandemic. She said it took more than a month and media attention to be granted a meeting with the Federal Aged Care Minister Richard Colbeck to discuss the astonishing issue. There was supposed to be money dedicated specifically for the increasing staffing and skills, but there's no accountability. There's no checking of where that money has gone. What did I say to you earlier in the video previous? They get so much money, these places, for taking care of these people, and yet look what's going on. There's no checking of where that money has gone, Butler said. In Queensland, South Australia, Tasmania, Victoria and some parts of New South Wales, aged care providers are actually cutting staff. We were told at the time, what did I actually tell you guys ages ago? I said if it gets to the point where they all walk out, I'm pretty much going to move into the fucking home and I'm going to take care of the 4 guys that are there with my bro. Because I ain't afraid of this shit, you know. You can't be afraid of something that doesn't exist, you know. But when it attacks the elderly, when it attacks the disabled, different story, because they're already health compromised. We were told at the time we did our survey that some providers had cut staff from the 1st of March, but over the last month or two, the feedback from members even from employees directly is that their cutting of staff has increased because they don't care. Do you see what I was saying before? They don't care. They don't care. Butler also said members had reported incredible breaches of infection control, with workers telling the union they could only use 1 glove rather than 2 to conserve PPE, while others were told to reuse equipment, put it in collective plastic bags. Michael Lai, a Deputy Secretary at the Federal Health Department, told the Royal Commission that advice outlined by a subcommittee of the Commonwealth's Australian Health Protection Principal Committee, all fucking committees, all departments, all kurats, you know what I mean? Kurats means dick, all right? They're all there just to collect a fucking big pay packet. Nobody does shit. To aged care providers to prepare for staff losses of 20 to 30% during an outbreak were unrealistic. Newmarch House head Grant Millard told the Commission on Tuesday that 87% of staff were unable to work during its outbreak. But they care, right? They care what happens to you. Keep listening to them. Keep listening to them. Don't go and see your family members. Just leave them there. Leave them there to rot. Leave them there to rot. Leave them there so that somebody else who doesn't give a fuck about them can just leave them there, and not take care of them. Ibrahim's comments about the magnitude of the disaster came after the Aged Care Royal Commission earlier this week heard evidence of a frustrating level of dysfunction between state and federal health authorities over whether to send infected residents to hospital, and a failure of the federal government and aged care regulator to develop a specific COVID-19 response plan for the sector. They're thinking about that now. They want to do that now. Dr. Brendan Murphy, the Department of Health Secretary, requested he be allowed to respond to the allegations the federal government failed to develop a COVID-19 response plan sector, but was shot down by the commissioners. Rosen subsequently noted Murphy had only been added to the hearing schedule at the request of the Commonwealth hours after the allegations of a lack of plan was first heard. Earlier, Ibrahim criticised the Aged Care Quality and Safety Commission for using a self-assessment survey for aged care homes. Anyone with a child at school would know that if you ask someone to self-assess themselves, they're either super confident and assess themselves as being fabulous or don't know enough about their own problems to say that they've got gaps. The system is broken. And what we've seen with COVID is that the system is broken at a high level because it's not the aged care workers that have failed us in this. It is our people who are in governance roles, and I'm not going to call them leaders because they're not leading. The people in governance positions who are accountable for what happens is where we have failed. They have not recognised the magnitude of the problem staring them in the face. Asked about the self-assessment process, ACQSC Commissioner Janet Anderson said she wasn't surprised that there did seem to be a large degree of confidence that providers were ready in the event of a pandemic. When asked why the self-assessments didn't ask if a facility had a COVID-19 outbreak management plan, Anderson replied, "I don't know." Ibrahim also said the so-called hospital in the home approach, which aimed to keep residents in aged care facilities during outbreaks, was wrong and inappropriate. He said the General Health Department document the government offered as an aged care COVID-19 response was not specific in detailing action and only acknowledged that aged care was a high-risk area. Hundreds of residents will die prematurely. Do we call that collateral damage, like war, when you sacrifice your own kids for these same fuckers? Is that what we're going to call this, collateral damage? Ibrahim criticised people in governance positions within Australia's aged care sector and governments for not recognising the magnitude of the problem staring them in the face, and said the fact different federal and state government bodies and regulators hadn't taken responsibility for aged care issues was causing confusion. The human misery and suffering must be acknowledged. This is the worst disaster that is still unfolding before my eyes, and it's the worst in my entire career. In my opinion, hundreds of residents are and will die prematurely because people have failed to act. There's a lack of empathy, a lack of urgency. There's an attitude of futility which leads to an absence of action. Ibrahim said that when he raised his concerns with governing authorities, both before and after the pandemic outbreak, he had received comments saying that everything is under control, that I'm simply overacting and causing panic. We fail because we have treated residents as second-class citizens. There's an absence of accountability. There still is, and there is no consequences for failing to deliver good care in aged care. On the failure to develop an aged care COVID-19 response plan by government and aged care regulator, claims since refuted by Colbeck and Acting Chief Medical Officer Professor Paul Kelly on Tuesday, Ibrahim said there had been an absence of plan management that you teach to undergraduates. Referring to the Department of Australian Health Sector Emergency Response Plan for Novel Coronavirus released in February, Ibrahim said, I think any person reading it would see that it doesn't do that. It's Australia's health sector emergency response. It's not Australia's aged care sector response. This health sector emergency response plan does not address what needs to happen in aged care. It simply says aged care is a high-risk area. There's fundamentally no gap analysis to prepare us, and that's the first step in, I guess, any situation around a problem. You know what are the strengths, what are the weaknesses, where are the gaps. It's not there. I'm surprised that the minister is relying purely on public health specialists and infection disease specialists to manage aged care when the department and the minister know full well the circumstances in aged care are quite different. The absolute lack of involvement and communication with care staff who are doing the majority of work in the facilities, I think, is negligent to the extreme. ASMA earlier said the union believed more than 1,000 workers, including carers, kitchen staff, cleaners and clerical workers in aged care, had contracted COVID-19 based on calls the union had received and made to facilities experiencing outbreaks. Diana Asmar, the Secretary of the Health Workers Union, told the Royal Commission union members in the sector were struggling to get personal protective equipment, including masks, and that some were making do according to an appalling 2 masks per shift guideline. I don't know what to say, people. What can one say? Just lock everybody up. Lock everybody up. You know? Lock everybody up. They're culling off the elderly, they're culling off the disabled. Like I said, people, if we're not prepared to come together, this is not going to turn out good for anybody. Can you not see this? Can people not see this? Australia's rate of death in residential aged care is more than 68%, the second highest in the world, behind Canada at 80%. When you see that something is broken, you need to get off your ass and fix it. The system, not just in Australia but everywhere, is broken. People, you need to come together, you need to stand up, and you need to fix it.